There's growing concern that finasteride and dutasteride, which are commonly used for hair loss, cause significant side effects, particularly sexual side effects, and side effects that not only occur on treatment, but in some men persist for some time after treatment, perhaps permanently. So I went and did a systematic search of literature to look for randomized controlled trials that address this issue. I could find 28 relevant, well-designed studies, and they suggest the following. In fact, number one, around 3% difference in the occurrence of libido between placebo and active treatment in men. There was around a 4% average difference between the occurrence of erectile dysfunction between placebo and active treatment. Now, there was significantly more incidence of change in ejaculate, though this, in fact, is the least concerning thing for men on this treatment. I did find 4 randomized controlled trials that examined this issue of persistence of symptoms after treatment. None of them, in fact, support that view. In one study, it was interesting because those patients that had sexual side effects at the end of treatment, later, when in fact they were re-examined, they had about half that level of persistence in each group, and it was consistent with what you'd expect for the increasing occurrence of sexual dysfunction as one ages. Now, what would account for the public perception and even also the results of observational studies that these side effects are much more common? I would suggest it's something called the nocebo effect. Placebo effect is the fact that if I think something good's going to happen with a treatment, it does. Nocebo is the opposite. That is, that if I'm concerned that a side effect may occur, that it's much more likely to happen. Well, there was a well-designed study to examine this issue when it comes to these medications and sexual side effects. They looked at active treatment versus placebo in a double-blind fashion, but there were 2 separate arms. They only differed in this. In one arm, the patient was told that there might be a small chance of sexual side effects on the treatment. Both in the placebo and active treatment in that arm, it tripled the percent of patients that experienced sexual side effects. And so this, in fact, explains very well the occurrence, but it still presents us with a dilemma. As physicians, we are under obligation to tell you about possible side effects. So it's difficult to get around this issue. But the good news is understand that your risk of erectile dysfunction may be 4 more in 100 people than those on a placebo.